Hello. Good evening. Good evening, fellow friends and loved ones. Yes, it's once again a very great privilege, yes, to come to your homes this evening, the 8 o'clock p.m. to continue our weekly discussions on various health conditions. Yes, today we've been an hour late. I'm sure we were noticed of the lateness, and we hope it will not happen again. Thank you very much for your time. And so we are going to talk about a very important and very interesting discussions um, this evening. Yes, last week we had a very wonderful discussion. I'm sure you enjoyed it, and this today's discussion promises to be very interesting. And so just take some water and just relax, and then enjoy the discussion. So today we're talking about a very important condition, and our outline is a description of the condition, a clinical relevant anatomy, the etiology, that's the cause, the epidemiology, that is some statistics around the world concerning this condition, and then clinical presentation, how it presents itself, and then differential diagnosis, how we can differentiate it from other conditions, the management, be it physiotherapy, be it surgical, and other management protocols, and also some key researches that have been done concerning this condition, then some lifestyle modification. Then we move on to your comments, your suggestions, and then your questions. So if you are listening, you can share the page to various other friends and loved ones, and I'm sure we'll have a wonderful time this evening. So we're talking about a very important condition that everyone is likely to have at a point in time, as research has shown. The condition is titled waist pain, or scientifically is termed as sacroiliac joint dysfunction. Sacroiliac joint dysfunction. Yes, so generally it's called waist pain. It's called sacroiliac joint dysfunction because it's from two words, from sacro and iliac, and then the sacro means sacrum. So at your back we have so many bones at your back that keeps you stable and keeps you upright. We have the neck bones, we have the upper back bones, we have the middle back bones, we have the lower back bones, and just under the or just below the lower back bones, we have some group of bones that are joined together, and they are fused, that they are joined together to form the bones that we call sacrum. And these are very important because they hold the waist bones together in unison, that is in one accord, so that it helps you to walk very well and gives shape to your waist and then to your buttocks. Yes, these bones are called sacrum, and so they hold your waist bone. Your waist bone has so many compartments. You have the ilium, ischium, and then pubis. Ilium, ischium, and pubis. But this bone called the sacrum, that is the one that ends after the lower bones, is called the sacrum. It attaches to the ilium, that is the upper part of the waist region, to form a joint called sacroiliac joint. So the sacrum, that's at the lower back, just below the lower back, and then also the ilium, which is around the waist region. Yes, I'm sure we'll see some pictures very soon, forms the sacroiliac joint. So in the point where there is dysfunction, that is, there is trauma, there is so many factors to cause the joint to be unstable, we call it sacroiliac joint dysfunction. And so generally people term it as waist pain, but this condition is actually relatively difficult to diagnose, as it presents with other conditions that look like this condition. And so doctors, physiotherapists go through very intense test procedures. We will talk about it very soon. Very intense tests, especially physical therapists or physiotherapists, to be able to diagnose this condition, because it's not easily diagnosed, and so a specialist is able to do that per experience. So we'll delve into the little thing that we've been doing to be able to diagnose this condition as waist pain, or scientifically sacroiliac joint dysfunction. So this condition is actually as a result of, we mentioned the sacroiliac joints. So in the points where the structures around the side are too flexible or they are too stiff, it could cause pain. If they are too stiff, movement becomes difficult, and then pain is a factor that shows that yes, there's something wrong going there. The place is not moving well. And also, if it's too much flexible, that is scientifically it's called laxity. That is when it's overstretched. It causes pain, and this pain can cause the joint to become hypermobile. That is too much movement around the side, and it causes pain. And then the physiotherapist or the medical doctor would diagnose the condition to be sacroiliac joint dysfunction. Okay, so as we're talking about sacroiliac joint dysfunction or waist pain, we'll note that research states that a significant source of pain, that's about 15% to 13% of people, are as a result of low back pain. So many people complain of low back pain. The entire population, that is a research carried out outside, that's in the United States of America, it was noted that about 15% or 30% of the population had low back pain. And so they were trying to trace the relation between low back pain and this condition called sacroiliac joint dysfunction. So there were so many tests to be able to rule it out. So this condition, as we mentioned earlier on, is very difficult to diagnose, and so sometimes the physiotherapist might say, well, the patient has low back pain, just low back pain. But then if it's not treated accordingly, the physiotherapist might be treating wrongly and the patient might be complaining of pain. So this is just probably a refresher courses to our colleagues and our senior colleagues, just to keep ourselves, and also to the entire public, that when we have such waist pain or such symptoms, it could be that condition, not just a low back pain. So the joints can be hypermobile or hypomobile, that is, there be stiffness in the joints or too much movement in the joints, and pain is actually localized. They are usually localized. The pain is usually localized. That is, the pain is at one place. It doesn't move into the leg. Hardly, very few times of the pain is moved downwards. Okay, so patients actually complain of pain at the lower back. Yes, pain is mainly at around the sacroiliac joint. So there's some pictures to show you how the pain presents and the region at which the pain presents. So let's stay tuned and let's listen. Okay, so another study also stated that the pain could move from the buttocks a little bit down to the thighs, but then research says that it's mainly localized, that is around the sacroiliac joint region, and pain is usually described to be sharp. So when the person comes to hospital, he complains of the pain being sharp, and the pain also being stubborn, that is pricking, and also the pain also being aching, and also the pain either being shooting. So like in the tree sense, you say a warming, like it's pricking me. Yes, it's pricking me. So some of the symptoms of the condition which the patient could present him or herself, it could be sharp, it could be throbbing, it could be stabbing, like someone is stabbing with a knife. And also patient actually has a frequent mimicking of the pain, and pain could be misdiagnosed as radicular pain. When we say radicular pain, it means the pain moves down into the legs. And so if the patient doesn't complain of the pain moving down the legs, then we could focus directly on the exact point of the pain. And also patients also frequently complains of the pain when sitting down. So a long time of sitting down the patient complains of pain. And when the patient lies down for a long time the patient complains of pain. And also when the patient lies or the person lies on the side, the patient complains of pain at the side which the person is lying on. So if the patient or the person is lying on the left side, the person complains of pain on the left hip region or the left waist region. And so these are all signs to show that it's sacroiliac joint dysfunction. If the person is lying on the side and complains of the pain, probably the person is lying on the left side and complains of pain on the right side, it doesn't mean that, or it doesn't conclude that the person has sacroiliac joint dysfunction or waist pain. But when the person complains of pain when lying on the left side, at the left side, then we can say there's a high probability of the person having sacroiliac joint dysfunction or waist pain. The person also complains of pain around the waist region when climbing. So when it's climbing the hill, the person says, my waist, I'm having difficulty. So there we can further diagnose or further carry out other tests to be able to diagnose this condition as sacroiliac joint dysfunction or waist pain. So some clinically relevant anatomy is that we've mentioned about where the sacrum is located, where the ilium bone is located. We'll be showing you some pictures very soon. So the sacroiliac joint is actually a joint between two bones, the sacrum bone and the ilium bone. Yes, the other bones around at the hip region. We have the ischium and then the pubis, but we're not talking about that one. We're talking about sacroiliac joint dysfunction, that is abnormality around the iliac joint or sacroiliac joint. Okay, so there are so many structures around the hip joints, and maybe when we look at the pictures, we can very much appreciate this structure we're talking about. There are synovial fluid there, the synovial joints there, there are ligaments there that hold the hip together and hold it very firmly. Because when we are walking, if these structures are not so strong, these ligaments, these tendons, these bases, these muscles are not so strong, I'm sure when we are walking, in fact, there's a high probability that we will fall, or even we could have an accident. Yes, and so these structures are very important. We have ligaments, sacrotuberous ligaments, sacrospinous ligaments, iliolumbar ligament, which is a very structurally strong ligament that helps us to be able to walk and hold other organs. So these structures are very important because we have so many very important structures and organs around the waist region. We have the kidney, we have the liver, we have so many structures there. So we just want to take note that the sacroiliac joint is a very, very important structure. Okay, so what are the causes of sacroiliac joint dysfunction or waist pain? Yes, there are so many causes, but it is very, very hard, yes, to determine exactly what causes this structural dysfunction called the sacroiliac joint dysfunction. But then, as age presents itself, as we grow older and older, there are hormonal imbalances that causes a wear and tear process where these structures called ligaments and tendons become weaker and weaker in terms of their strength. And so when they become weaker, then they predispose these bones and then this tendon to move in an abnormal way, and this could present itself with pain, and then we can diagnose this condition as sacroiliac joint dysfunction. And other causes also include trauma. So there could be probably a heavy fall, or there could be a heavy blow, or probably you're in a car and then you had an accident. This could also cause the shift or tear in structures around the sacroiliac joint, and it could cause sacroiliac joint dysfunction or waist pain. And so research has also stated that pregnant women after delivery tend to have this condition called sacroiliac joint dysfunction. This is because we have the baby sitting in the womb, and the womb is around the stomach region, and so just below the stomach region we have this sacrum and then the pelvic bone. So the pelvic bone actually is where the baby sits. The baby sits on the pelvic bones and then it grows, and so due to the size of the baby could be 4 kilos, the baby could be 3 kilos. Just imagine you're holding a 3 kilo bag of rice for 9 months. I'm sure you have some bruises, you have some redness around your fingers, and such a case where a mother is carrying a baby for 9 months and walking about and doing and carrying out active activities. So there's a likelihood that there could be tears around the structures called the sacroiliac joint, and this could present itself with pain, discomfort, and then other swelling. There could be other presentations which we're talking about very, 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 very soon. And so it's noted that females are likely to have this condition on a higher pedestal because of the fact that they get pregnant and then they are likely to be to have the weight or undue pressure on the pelvic bone, where we have the sacroiliac joint. Okay, so it's also stated that the females who tend to be 50 years and above, where they get to menopause very early, they have very low level of hormonal production around the structural sites. We have where they have the ligaments and the tendons, and so they tend to have weak structural elements such as the ligaments, and so they could have presentation of this pain or sacroiliac joint dysfunction. So when we talk about epidemiology, what are other statistics that show that this condition is prevalent? So it is noted that about 90% of the population are likely to have low back pain in their lifetime and report to the clinic. So that's what the research has said. About 90% of the population would very much probably have low back pain. And so out of this 90% of people who have low back pain, about 10% of them, or 10% to 25% of them, are likely to present itself with sacroiliac joint dysfunction. So when we juxtapose these two comparison, that is this percentages, 90% of people having low back pain, and then out of the 90%, 10% or 25%, or 10 to 25% of people having waist pain, it means that there could be a higher number of people who will have low back pain without having the waist pain. But then when we probe further through various investigations, which we'll be talking about very, very soon, we note that those who have low back pain could have sacroiliac joint dysfunction either with a low back pain or on itself, where the low back pain is pretending to be the main cause. Okay, so we're talking about waist pain, low back waist pain, that is sacroiliac joint dysfunction. And so we have other structures that are around the waist. We have the low back, that is the bones around, that's the low back bones, and then we have the thigh bones, which move up to form the hip, and then they connect to this waist. Okay, so these are some of the bone structures that are found around the waist. Okay, so it's noted that this disorder actually is common among individuals who lead sedentary lifestyles. So those who don't like walking or performing activities such as going to work, and even those who go to work, those who sit for a long time, such as bankers, are likely to have this condition called sacroiliac joint dysfunction. And so it doesn't mean that if you sit for a long time you won't have this condition, but then if you sit for a long time you could have this condition. Or if you bear with me, our market women who sit for a long time, they are likely to have this condition called the waist pain or the sacroiliac joint dysfunction. So we are just preaching this message that if we have our mothers who sit a long time, we encourage them to at least hourly or every hour try to get up and take some walks to avoid having this waist pain or this sacroiliac joint dysfunction. And probably when they experience this condition or this waist pain, report to the medical doctor or the physiotherapist as early as possible, so that we can treat this condition, because when it becomes worse it could affect other structures and it also affects your work as a whole. Okay, so this disorder actually is seen in all genders, both genders, that is male and female. It has no respect of person. It doesn't mean that you're male or female, it could spare you. Yes, and then it could affect all races, whether you're from China, whether you're from America, whether you're from Africa, whether you're from Europe. It doesn't respect anyone. So some of the symptoms for this condition called waist pain actually is, as we mentioned earlier on, it's difficult to be able to diagnose, but then we have some symptoms that you could have or present yourself, and then you could have this condition diagnosed as waist pain or sacroiliac joint dysfunction. So the person or the patient could complain of thigh pain, low back pain. The person complains of sitting down for a long time, accompanying waist pain. So the person could complain of waist pain when sitting down for a long time. The person could have also pain with stress. So when the person involves in activities such as climbing a hill or probably carrying a heavy material or carrying heavy things, such as if you look at masons, if you look at those who engage in carrying heavy things, they're likely to injure this joint called the sacroiliac joint and could present itself with waist pain. Okay, so the pain is actually localized around the buttocks region, and then the pain could be actually sharp, it could be stabbing, it could be shooting, as we mentioned earlier on. And then we should understand that
register call number Dodge. Amo, whatever. We amo, Kote, oh, English, that was.
Okay, yes, we are talking about the same thing that the person presents, and so the person could have the pain being stabbing, it could also be piercing, and it could be a sharp pain, and also the pain is actually at the side which the person lies. So if the person is lying on the left side, the person complains of pain at the left side, or the other way around. So other condition that could look like this condition we're talking about, the waist pain, is the person could complain of radicular pain, that is the pain moving down into the legs. We have a condition we call sciatica. I'm sure now sciatica has become a very household name in Ghana, and we also have a condition we call piriformis syndrome. I'm sure probably we'll be talking about this in subsequent discussions. And also we have a condition we call Ankylosing Spondylitis, and then lumbosacral fetus syndrome. So many conditions. You have spondyloarthropathy. These are other conditions that could look like sacroiliac joint dysfunction or waist pain. But then through various investigations, we can narrow it down and rule them all out. And so let's take into consideration this. We have hip fracture, where we have probably a break in the bone around the hip. So how do we diagnose this condition? We have various essential tests that we carry out as physical therapists to be able to rule out other conditions that look like waist pain but they are not waist pain. So we have tests such as the Trendelenburg test, we have the distraction test, we have propagative tests that we carry out as physical therapists, and this helps us to be able to rule out other conditions. Aside that, we also have definitive radiological examinations. We have the CT scan, we have the MRI, we have the X-ray. These are all scans that helps us to be able to rule out, in the case of any fracture, in the case of any strain or any inflammation around the structure, around the region of the waist. So we also have the ultrasound. The ultrasound is also a very important device that helps us to see if there's any ligament tear or any other malformations around the waist region. So aside this test, also we go through exercises that helps us to be able to treat this condition when it's noted. We have physical therapy, we have Also, um, rest, which is very important. When you have this condition, you need to rest, because in resting, there could be regeneration of the structural components around the waist to help us to be able to regain our function as best as possible. And also, we also have a device we call the corset. I'm sure you've heard about corset before. The corset also is very important. This is like a belt. It also helps to keep the waist at least supported and preventing further movement around the sacroiliac joint. And this helps also to be surgeon in the case where there is no, so where you have the orthopedic surgeon where the pain still persists. So we engage these professionals, which we in collectively we call the multidisciplinary team, to be able to treat this condition as best as possible. So let's look at some of the pictures that we are talking about, and I'm sure we can appreciate it more. Okay, so let's see. Okay, so I'm sure I've been talking about it for quite some time now. So this is the sacroiliac joint. So you can see the description here. This is the sacroiliac joint. It's a very important joint, and then it helps. So this is where the baby sits when the baby is being conceived and is growing. The baby sits here, and so if there's undue pressure around this region, it could cause distraction of these structures there, and it could cause sacroiliac joint dysfunction or waist pain. Okay, so these are some of the this is the anatomy of the waist region. Okay, so this is where the pain is. So you can see the redness around the side. This shows that there has been injury there, either by trauma or by wear and tear as a result of aging. Okay, so this is the anatomy. You can see the sacroiliac joint here. So this is the smaller component, and this is an extensive or an enlarged structural description. Okay, so this is also where the waist is. You can see the redness around the side. This shows that there's waist pain around the side. So you can see the waist pain. The person complains of waist pain by this diagrammatic presentation. Okay, so another one here. Okay, I'm sure we can see them there now very clearly. Okay, another one there, another one there. Okay, yes, so another one there. So this is a very good description of all that we're talking about, the courses. So this is a very extensive picture to show the anatomy of the waist. So this is where we find the sacroiliac joint. Yeah, so you can see it now very clearly here. Okay, so another one there, another one there. Remember, I said we have so many pictures around the side. Yes, so these are some pictures, so many pictures. So you can see also it's advisable that as when we give birth, we shouldn't carry the baby mostly on one side. It could also affect our waist, and it could have the condition we are talking about today as sacroiliac joint dysfunction. Okay, and so this is a very extensive component of the waist. That's the ligament, that's the structure that hold the bones together. You can see it here. Okay, so these are some of the exercises that when you have waist pain, we teach the patients to do. So you can see the first one, stretching of the leg there. You can see the one here, another one here, and then lying on the back, and then bringing the legs together, and then also putting a pillow in between the legs and squeezing them, and also shifting your legs, closing your legs together when you're lying on your back, and bending your knees and shifting to one side and the other. You can also lie on your stomach and then squeeze your buttocks inside, and so you can lie on your back and then bend your knees and hold and push it back. And then another one, so you can lie on your back and then bend your leg and push it backwards. Okay, some of the exercises, these are some of the exercises also that we can do. Okay, some of the exercises, yes, very extensive exercises. Another one there. Okay, these are some of the exercises. Okay, so it's advisable that we don't engage in these sporting activities when we have this condition called sacroiliac joint dysfunction. We should avoid bicycling or cycling. We should avoid weightlifting. We should avoid crunches or sit-ups. You should also avoid playing golf or football when you have this complaint of waist pain. These are some of the exercises that we do also. We teach. Okay, so yes. Okay. Okay, so yeah, I'm sure you can appreciate how extensive today's discussion has been, and some of the exercises that we treat or we go through with the patients, that is, as physical therapists. And so you bear with me that yes, it's very, 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 very extensive. Yes. And so you should note that if you have waist pain, you should actually report to the appropriate headquarters, that is seeing a physiotherapist or the medical doctor, so that we can diagnose the condition as such. So today we've talked about waist pain or sacroiliac joint dysfunction. I'm sure you've had at least a fair idea of what it is, and then when you have the symptoms presenting around the waist region, you have some pictures to show. You report as early as possible, because for early treatment we need to have an early report of this condition. Okay, so without much ado, we thank you very much for your time and your airtime. In fact, it's very important for spending time with us. And then we had a couple of us joining in, and so I want to thank you for your time. And so next week we'll be talking about also a very interesting condition. Yes, I'm sure you also be interested in watching or listening to this condition. And before we talk about this condition, we would like also to engage us in, you can ask us any question on our platform and we are ready to answer. And so this is sponsored by a foundation called the RICOY Health International Foundation, and this helps also to propagate health related activities. Yes, so we propagate them, and so we ensure that there is good knowledge of our health and then preventive lifestyles. Okay, so our next topic is titled Ankylosing Spondylitis. It's a big word, but let's stay tuned and let's also share the flyers. I'm very glad about this times and these topics our input in terms of sharing these flyers, and I'm sure that we learned a lot to today's topic as waist pain. And so we're very, very, very well positioned to share our knowledge to the entire public. Thank you very much for your time. May the good Lord be with us all. Have a blessed evening and have a wonderful week. Take care, and next week is a new month, so happy new month in advance. May the good Lord be with us all. Good evening, take care, and bye.